So what you see here is a sagittal section of the vertebral column below the lumbar vertebra. So here you have the L1, L2 and up to the sacrum here. So these are the bodies of the lumbar vertebra in front. So this is the anterior part and these are the lamella and the spinous process of this corresponding vertebra, that is the posterior part. Now, we know the spinal cord, the parenchyma of the spinal cord ends at the lower border of L1. Alright, you can see here. So this is called as the conus medullaris. So what happens after that? The spinal cord ends at the level of L1, but the meningeal layer, that is the dura, arachnoid and pia, extends all the way down to the sacrum and coccyx. So here, what you see here in the blue color, this thing is the pia mater of the meninges, which is called as the phylum terminale. Okay, this is a phylum terminale. Now, just covering the pia mater is the arachnoid matter, which you can see here, and the dura mater, which is also seen outside. Alright, so you have the dura, arachnoid and the pia represented by the phylum terminale, but the spinal cord parenchyma is absent below the level of L1. So this is the reason why we always opt to do a lumbar puncture between L3 and L4 conventionally. So you can see the needle piercing the space between L3 and L4, which is a conventional region where we do the lumbar puncture. So when we do the lumbar puncture, let us see what are the layers which you have to pierce. First is the skin. Obviously the skin, we will have to pierce the skin, followed by the subcutaneous tissue, alright, which is followed by a ligament which is seen above the spine, that is a supraspinous ligament, which is followed by an interspinous ligament, that is between the spine, which is followed by the ligament between the lamella of the vertebrae. We call it as the ligamentum flavum. Alright. Now again you go deep, you reach outside the dura, we call it the epidural space. Then we pierce the dura, so we can call the next layer as the dura mater. So moment you pierce the dura mater, you have the subdural space. From there you pierce the arachnoid mater. Then you reach the subarachnoid space. It is in this subarachnoid space you get the CSF. So these many layers are pierced before you reach the subarachnoid space. To conclude, you have a